Health Tips, brought to you by St. Joseph's Hospital.
Good morning and welcome to Health Tips, St. Joseph's monthly wellness information program. I'm your host, Denis Sweeney. My guest today is Kathy Reagan, Clinical Program Coordinator for St. Joseph's Behavioral Science Unit. Kathy will talk about the signs and symptoms associated with suicide and what all of us can do to help prevent these tragedies from happening. Good morning, Kathy.
Good morning, Dennis.
Kathy, what do you believe are some of the reasons why so many people of all ages are dying from suicide each year?
Well, over 90% of people already have a diagnosable and treatable mental health issue before they do die by suicide. For instance, with depression, major depression, bipolar, or drug or alcohol abuse could be factors. The good news is that suicide is preventable. Most people don't really want to kill themselves. What they need is some help figuring out solutions to their life problems. And the majority of people that get help do very well.
What are some of the signs and symptoms of suicide that would help people identify someone who needs help?
The main sign would be if someone's speaking about suicide or threatening suicide. All threats should be taken very seriously. Also, if someone's showing a lot of rapid mood swings, or if they're hopeless or feeling like their life doesn't have purpose anymore, if they have drug or alcohol increased use, any of those would be signs.
Now, how does death by suicide affect the family and friends of the person?
I don't think the family and friends ever really recover from a death by suicide because it's much more complicated for people than a natural death would be. There's very often depression, there's guilt, there's anger, and there's a higher risk for depression in people who have lost people to suicide.
Finally, Kathy, where should people turn to for help if they notice someone that is exhibiting these suicide warning signs?
We have a lot of agencies in this community that can help. So the first thing to do is ask for help. The person needs to let somebody know that they're suffering. There's no sign of weakness in sharing that they're having suicidal thoughts. That's only a symptom. Help is available.
Thank you very much, Kathy. I've been talking with Kathy Reagan, Clinical Program Coordinator for St. Joseph's Behavioral Science Unit. I'm your host, Denis Sweeney. Please be sure to join us again next month at the same time for our next edition of Health Tips. Until then, have a happy and healthy month.
Health Tips has been brought to you by St. Joseph's Hospital.